The focus of hospice care is on the emotional, spiritual, psychological needs of the patient and the family, just to be there to provide that comfort care, palliative treatment of the pain symptom managements. There's a team concept in hospice where it's not just the nurse, it's not just the doctor. We all work together with the patient and the family to try to meet the needs of the patient and also the family. You're caring for the terminally ill. You're taking a very intimate moment, the last moments of a patient's life or a person's life, and caring for them.
Well, the whole philosophy of music therapy fits in perfectly with the hospice philosophy, such as expressing emotion, facilitating life review, especially with some of our Alzheimer's patients and patients that might be experiencing early dementia. The brain does not focus on pain when it's processing music, and so it's a wonderful intervention for pain management, which very much fits into the hospice philosophy. We also provide bereavement support. The hospice program will follow a patient's family for 13 months after the death of their loved one, and music therapy services are another way. Be a support to them. I may not have ever met the actual hospice patient, but do music with a spouse.
In a 2003 study, Dr. Hillard, a well-known hospice music therapist, examined the effects of music therapy versus routine treatment on the quality of life and physical status of adult patients diagnosed with terminal cancer. Specifically, the scores for patients receiving music therapy were significantly higher than those who did not. This study is the first to document empirically the effects of music therapy in enhancing the quality of life for people with terminal cancer receiving hospice care services. As expected, quality of life decreases over time, but when patients receive music therapy, quality of life can increase despite physical decline.
Music therapists not only address emotional issues, but they also can address the physical issues that hospice patients are having. Music therapy has been proven to decrease pain, decrease blood pressure for people with high blood pressure, and music therapy can even decrease nausea and vomiting in patients that are experiencing some of these unpleasant side effects.
You're a music therapist, so are you going to teach me how to sing or how to play an instrument? While active music making can be a part of our interventions, it's certainly not our primary focus. Our primary focus is on the individual needs of that patient or family member. Another common myth about music therapists is we can be anybody that uses music in a professional setting can be music therapists, which is definitely not true.
I think a common myth is, especially when we're seen carrying a guitar into a nursing home, that all the entertainment is here. And after the patients receive music therapy and the families receive music therapy, I think that they all gain a deeper understanding of it's much more than entertainment. But as a music therapist, we are trained on how to use music in a therapeutic way, and we address very many issues such as pain, expression of feelings, things like that through the music, and it does become much more than entertainment. The training for music therapists is pretty diverse. A music therapist does receive a bachelor's degree of music therapy from a university or college, and there are 60 colleges in the United States that offer degrees in music therapy. Not only do we study music and music theory and music therapy, we're also trained in psychology and group processing and anatomy that help us understand the body and how music is relating to the body. After that, we do an internship that's 1,040 hours, and that equals out to about 6 months of full-time training with the music therapist on site. And then we sit for a board exam and become a board certified music therapist. And then there's also continuing education after that, just like many other professions.
The value of music therapy to hospice is invaluable. They are just another team member that can go out to assist with the patient's needs, whether it's pain or anxiety. Sometimes it's just loneliness that they can go out and provide that support to the patient.
Music therapy can be used in a variety of ways to meet the needs of our hospice patients and families.
Maxine and I are deeply appreciative of the music therapy my mother was provided. Nothing is more important than reflection at a time of a loved one's passing. Your music provided a feeling of serenity that was deeply appreciated by our family.
When I started playing the music, well, she knew what was going on, and she'd kind of try to sing along sometime, and another time she'd take her foot and wiggle her toes to the time of the music. And she really enjoyed it. I think it helped her through a lot of it.
At State of the Heart Hospice's free annual children's grief camp, music therapists provide drum circles, fun music, and movement exercises, as well as instrumental exploration of feelings.
Music therapy was a part of my healing through my grief because it was inspirational and peaceful and joyful. It was very inspiring to her as well as to myself to be able to enjoy her company and hear her sing her songs.
It just lifted the atmosphere when she come. After she left, was over be calmed down a lot.
I had heard of music therapy being used in hospice, but not in the local area at all until we heard about it through State of the Heart. During the last week of my mother-in-law's life, and she was in the nursing home, and we were there, and the music therapist came and brought her guitar, and the three of us sang hymns really to my mother-in-law. As a result of our feelings toward the music therapist and how she had helped us all, we did ask her to be a part of the funeral service, and she sang, and she said a few words at the funeral as well.
The brain does not focus on pain when it's processing music, and so it's a wonderful intervention for pain management, which very much fits into the hospice philosophy.
Music therapists not only address emotional issues, but they also can address the physical issues that hospice patients are having.
Music therapy helped me because it gave me joy, happiness.
The value of music therapy to hospice is invaluable.
Oftentimes, when words fail, music speaks or sings.
There was a song that the music therapist wrote, and they sang it to her. And then later, as they would sing that, it was just a blessing to my husband and I as well.